Everyone, welcome back to my channel. Today I am going to discuss part 2 of selection of teeth. And in this lecture, we will discuss dentogenic concept in detail. Let's move on to the lecture. So we have discussed the anterior teeth selection process. It is an important role in the aesthetics of a patient. And the following factors which are considered during the selection of anterior teeth. They are size, form of the teeth and color or shade of the teeth. So we have discussed the size in the previous lecture. Of the anterior teeth, the tooth size should be appropriate to the size of the face and sex of the patient. And the various methods used as a gauge to select the size of the teeth are pre-extraction records, anthropological measurements of the patient, methods using anatomical landmarks, and the methods using theoretical concepts, and finally the other factors. So we have discussed these factors in detail in the previous lecture. We will discuss the form or shape of the anterior teeth. Actually, it is selected according to the form and contour of the face, dentogenic concept and pre-extraction records. So coming here, this is the picture showing the shape. That is three basic shapes are there. That is circle, square or rectangle and triangle. The morphology of the maxillary anterior teeth is a fusion of these three basic shapes. And these shapes are analogous to the primary colors, that is red, green and blue, from which any color can be created. Any shape can be created from a circle. So similar in the way that any shape can be created from a circle, square or triangle. The unique composite morphology of the teeth allows diversity and individuality. So no two teeth are ever alike, but all share the same geometric building blocks. Okay. The shape of the maxillary anterior teeth has been the subject of numerous studies. The most prominent are by Williams and Fresh and Fisher. And the Fresh and Fisher concept is concerned with the dominance of the central incisors and their wear in advancing years. So here the picture showing the maxillary central incisors with worn incisal edges conveying an aged dentition. Here the opposite is evident for older individuals with the sharp incisal edges and pronounced incisal end ratios conveying a youthful dental appearance. Here the virgin maxillary central incisors with pristine unworn incisal edges and developmental lobes. This is a youthful dental appearance. Okay, that is young dentition. Young age dentition revealed the young age dentition. So if no records are available, the points to consider are age, sex and race and personality. So for example, the youthful teeth are sharp, having unworn incisal edges with the central incisor dominating the composition and in harmony with the laterals and canines. And the reverse is true for an older dentition. That is the blunt incisal edges and wear and attrition without conclusive dominance of the maxillary central incisors. Then, the females which display curvaceous features, both facially and bodily, devoid of sharp line angles. On the other hand, the masculinity is associated with ruggedness and sharp line angles. The process of transposing these gender variations onto the shape of the teeth is a concept termed morphopsychology. So this picture shows the feminine teeth, curvaceous outlines, devoid of sharp line angles, and also notice the mesial inclination of the lateral incisors. Here it is a masculine teeth, rugged outline, dominance of the central incisor and distal inclination of the lateral incisors. Here it is a tooth size which is determined by the mesiodistal width, which is divided by incisor-gingival length, which yields the width by length ratio. Here it is measuring the incisor-gingival length of the central incisors with calipers, and this is the mesiodistal width of the central incisors with calipers. When the central incisors erupt, they are pristine with defined incisal lobes, textured surface roughness, bright enamel with a smaller WL ratio. During normal functioning, excluding the effects of disease, the incisal edges wear, resulting in a larger WL ratio. Surface texture becomes smooth and enamel dulls due to increased translucency. And these processes are congruous with the aging of the rest of the body. Creating teeth with a youthful appearance is discordant in an older person and creates a sense of artificiality. So this is an aged teeth, smooth surface roughness, stained fracture lines and low value dull enamel overlay. Finally, WL ratio of the central incisor should range from 0.75 to 0.8. Okay, and value less than 0.6, which creates a long narrow tooth, and beyond this number results in a short wide tooth. So here it is a width by length ratio. Blue tooth has a WL ratio of 0.8. Red, that is ideal, that is 0.75, and green, that is 0.6. So central incisor should be the dominant element in the anterior dental composition. So here the picture shows the dominance of the central incisor is paramount for pleasing anterior maxillary aesthetics. Here this is the overbite assessment of two crowns for the maxillary central incisors. So vertical overbite in relation to speech and anterior guidance needs addressing. Besides these fundamental principles, subtle variations can be introduced which account for gender, race, facial, morphopsychological and psychological factors. This is the buccolingual thickness which is measured at the junction of middle third and the incisor third of the tooth. This is the green line. Okay. So coming to the golden proportion. This golden proportion which relates to the mesiodistal width of central, lateral incisor and the mesial aspect of the canine. Okay. 1.6, 1 and 0.6. That is 100%, 62% and 38%. Okay. This is the golden proportion or golden ratio. In this picture, it shows if the mouth is not centered in the face, then the midline of the smile should be in harmony with the facial features nearest the mouth, such as the nose and philtrum. Here, when each tooth is viewed from the facial aspect, the canines are second in width to the central incisor. However, when viewed from the midline, each tooth appears narrower than the tooth mesial to it. It is suggested that apparent width be 60% of apparent width of the adjacent mesial tooth. This is the picture showing various rectangles. Hi friends, which of these five rectangles is most pleasing to the eye? Is it A, B, C, D or E? What is your answer? Actually, both B and C are golden rectangles. Because of the in 1876, Fechner found that 75.6% of the subjects that he tested expressed a preference for rectangles with ratios ranging from 0.57 to 0.67, with 35% selecting the golden rectangle with a ratio of 0.62, and it is the most pleasing visually. Okay. So which are the most pleasing rectangles? B and C, because its ratio is 0.62. This is a picture showing the Parthenon, which is built in Athens in the 5th century BC. Why is it visually pleasing? Because the front of the Parthenon fits within a golden rectangle. So this is a golden rectangle. Okay. And the dimensions of the Parthenon built in Athens, which fit within the golden rectangle. Okay. So the ratio of 1.618 to 1.0 is a constant that is designated as phi. Golden mean, golden section, golden rectangle, golden proportion and divine proportion are all the terms that have been used to describe various aspects of this proportion. This ratio has been celebrated as the standard of visual aesthetics since ancient times. So shape of the patient's face or facial form. They are ovoid, square, tapering and combination of the above. So the form of the tooth should conform to the contour of the face as viewed from the front and side, that is profile. So here this is the square form, this is the tapering and this is the ovoid. The form and shape of the teeth is also selected according to the facial form. So here square facial form, this is a tapering and this is the ovoid. What is square? The lines are almost parallel. See here the lines are almost parallel and here the lines converge towards the chin. Okay, this is tapering and this is ovoid, that is lines diverge towards the chin. So William formulated a method called the law of harmony. He believed that a relationship exists between the inverted face form and the form of the maxillary central incisor in most people. So he described three typal forms of teeth as square, tapering and ovoid. Okay. So this is the profile or side view. So form and shape of the teeth selected according to the facial profile. Okay. According to facial profile also the form and shape of the teeth is selected. So to determine the facial profile, forehead, base of the nose and chin points are considered. So the profiles are classified as straight or convex and teeth are selected accordingly. Okay. Leon Williams has classified the facial form based on the approximate shape of the face as square, tapering, and ovoid. The points on the temporal, zygomatic, angle of the mandible are taken to form the lines outside of the face. Okay. This is the Leon Williams face forms: square, tapering, and ovoid. And the facial profile is classified as class 1, class 2 and class 3. Class 1 is straight profile, class 2 is retrognathic or convex profile, and class 3 is prognathic or concave profile. And this helps in the selection and arrangement of the artificial teeth. So here the forehead, base of the nose and chin points are considered for the classification. Flatter teeth are preferred for the patients with the straight profile, facial profile. This is the facial profile and the labial convexity. And here this is the arrangement of maxillary laterals in males. Here it is the arrangement of maxillary laterals in females. Arrangement of maxillary anteriors in relation to the lower lip in males, and arrangement of maxillary anteriors in relation to the lower lip line in females. This is the incisal view of the maxillary anterior teeth in females, and this is the incisal view in males. Here the exposure of canines while smiling in females, and this is the canine is more prominent in men. Okay, so this is the exposure of canine while smiling in males. And for executives, there is a small teeth is very aesthetic, pleasing. And there may also be a relationship between the form of the teeth form and the form of the residual ridge also. That is a square, okay, square arch form, then tapering, then the ovoid. So there is also this type of relationship. Okay. Coming to the vertical distance between the ridges, this determines the length of the teeth. When the space is available, it is more aesthetically acceptable to use the teeth that are long enough to eliminate the display of the denture base. Here the interridge distance is less, shorter teeth are used. Here the distance is more and longer teeth should be used so that the display of denture base is less. This is more aesthetic. And the lips again gives the selection of length of the maxillary anterior teeth. So at rest, the relationship of the incisal edges of central incisors to the lip line amount of tooth exposure depending on the age and sex of the individual. So in young female, there is a 3 mm tooth exposure below the lip line at rest. The young male, there should be 2 mm, middle-aged 1 to 1.5 mm, and elderly 0 to 2 mm above lip line at rest. So amount of tooth visible below the upper lip should be more in young patient than an elderly patient. Most important concept regarding the teeth selection, mainly anterior teeth selection, that is dentogenic concept. It is otherwise known as SPA concept. So tooth selection using the concept of dentogenics is based on the age, sex and personality of the patient put forth by Fresh and Fisher in 1955. And this concept has been explained as prosthodontic appearance interpretation of 3 vital factors which every patient possesses. So these factors are sex, personality and age of the patient. Here the mold selected for male with the sharp edges, and here the mold selected for female with the round edges. So curved facial features associated with the femininity and square with the masculinity. So to create harmony between the tooth form and face, teeth of females may be more ovoid or tapering than square as compared to the males. So incisal edges may also be rounded for females. Square feature is associated with the masculinity. What is personality? A vigorous personality requires square teeth with flat incisal edges, while a delicate personality requires ovoid teeth. What is the significance of age? With age, teeth wear at the incisal edges and interproximal surfaces. Labial surfaces seem flatter and form appears squarer. The same should be considered while selecting the teeth. So the teeth were selected and arranged according to this SPA concept or dentogenic concept. Okay. So that is the sex factor, that is expression of feminine characteristics from her fingertips to her smile. A woman is feminine. Expression of masculine characteristics, that is from his fist to his mouth. A man is masculine. Okay. A basic tooth form which expresses masculine characteristics shows vigor, boldness and hardness. So what is the significance of age? The patient can be either young, middle or aged or old aged. The four factors are observed in advance in the age of the patient. So here the muscle tone decrease, sagging of the cheeks occur, lower lips also occurs. To prevent cheek biting due to sagging, horizontal overlap of the posterior teeth can be increased. Intraocclusal distance reduces with age, hence mandibular teeth are more visible than the maxillary teeth. Old people usually have abraded teeth with worn out contacts, hence the placement of contoured teeth may look artificial. Old patients have gingival recession. It can be reproduced in the dentures to provide a natural appearance. Old people show a blunt smile line and pathologic migration of the teeth. And color of the teeth also changes with the age. In old people, the enamel is abraded and the dentine which carries a yellow tinge, it is more visible. Okay. And the personality, the dentist should select and arrange the teeth so that it improves the patient's personality. And the patient can be either vigorous or delicate. So there are two types of personality, that is vigorous or delicate. More squarish, larger teeth are selected for vigorous people. And the anteriors should be in a flat plane for executives. For executives, the teeth should be relatively smaller and more symmetrically arranged. Okay. And coming to the color of the face, hair and eye, this helps in determining the tooth shade. Though there is no scientific evidence to associate the color with a particular tooth shade, a harmonious relationship of all of these should exist. So, in color, that is the hue, value and chroma. Okay. So before selecting the color for anterior teeth, some basic concepts about color should be understood. A single color can be described under four parameters, that is hue, value or brilliance, chroma or saturation and finally translucency. What is hue? It denotes a specific color which is produced by a specific wavelength of light. It should be in harmony with the patient's skin color or else it will produce an artificial look for the denture. What is chroma or saturation? It is the amount of color per unit area of an object. In other words, it denotes the intensity of the color. Objects with highly saturated colors lack depth. What is brilliance or value? It denotes the lightness or darkness of an object. It is actually the dilution of color with either black or white to produce darker or lighter shades respectively. In people with the light skin color, teeth with lighter shades should be chosen and vice versa. Then finally, translucency. It is the property of an object to partially allow passage of light through it. Enamel has high brilliance and translucency, hence artificial teeth should also show the same properties for a natural appearance. And hue and brilliance or value of a tooth are influenced or determined by various factors. Which are they? Age, habits, complexion, color of the eyes, color of the patient's hair. Coming to the selection of color for the teeth, there are various steps. Okay. So first one is the side of the nose. This point will help to determine the basic hue, brilliance and saturation. Next one is the selection of the color of the anterior teeth at various reference points. This reference point gives an idea of how the teeth will look and when the patient is relaxed. And here, this reference point gives an idea how the teeth will look when the patient is smiling. This is known as squint test for shade selection. It is used to check and compare the color of the teeth with the color of the face. The dentist should partially close his eyes to reduce light and compare artificial teeth of different shades with the color of the face. The color of the teeth that fades first from view is least conspicuous or contrasting to the color of the face. So this is least conspicuous shade fades out first. This is too dark and this is too light. That is squint test for shade selection. Okay. So coming to the commercial gates available. Many forms are available to the dentist to aid in selection of denture teeth, including physical mold gates. Although normally designed for a specific manufacturer system, the information obtained can often be used with any other system. This is an example of a physical mold gate. Here the denture teeth used in mold gates appear to be normal denture teeth as sold by the particular company. Denture teeth in the mold gate may be of poor quality and should not be used in actual dentures. So there is a device which is known as true bite tooth indicator. This is the true bite tooth indicator. It can be used for estimating the size and outline as well as the profile forms of the maxillary anterior denture teeth. And tooth width and length are based upon average 16:1 ratio of the bizygomatic width and height of the face in relation to the width and length dimensions of the natural maxillary central incise. Indicator's face plate has two registration bars, one on the left side and one at the bottom, and which are moved along the slots and locked in the position against the skin of the zygomatic region and underside of the chin, with the mandible at the rest position. The maxillary central incisor width and length are read directly from the corresponding scale as indicated by the position of the bar surface in contact with the patient's face. Okay. And this truth by tooth indicator also used to determine the patient's profile form for matching to the denture teeth. And with the device held in place, the operator observes the relative straightness or curvature of the profile. And the three reference points are used, that is forehead, base of the nose and the point of the chin. If these points are lying in a straight line, then the profile is considered as straight. If the points lie posterior to the base of the nose, the profile is curved. Again, while useful, there appears to be no scientific findings that validate the use of this information. So, determine the facial profile with the true by tooth indicator. Okay. And there is another grade for maxillary anterior tooth selection, that is Ivoclar Vivadent Blue Line Form Selector. It features like a caliper, facial meter for correlation with the patient's initial alar dimension with tooth mold width. And this system also incorporates the cards with actual size photographs of 6 maxillary anterior teeth. And these cards are helpful in selecting tooth form and tooth length. That is softer bold tooth form, shorter to long tooth length. Okay. So coming to the pre-extraction records. This can provide information about the size and form of both anterior teeth. These will include facial photographs. It provides general information about the width and outline form of the anterior teeth. Okay. Then the diagnostic cast. The cast of patient's natural or restored dentition provide information which is useful to select the size and form of the anterior teeth. Then radiographs can provide information about the size and form of the teeth. Then teeth of close relatives, that is sons or daughters, tooth size, color and arrangement can be effectively used in selecting and arranging artificial teeth for their parents. And then extracted teeth. It provides information about the size and form, should not be used for selecting color. So these are the various factors which related to the anterior teeth selection. That is size of anterior teeth, form of anterior teeth and color of the anterior teeth. So what is the size? That is pre-extraction records, anthropological measurements of the patient, anatomical landmarks, theoretical concepts and also other factors. Then what is form? Shape of the patient's face or facial form, patient's profile, dynastic concept or dentogenic concept. Then what is the color? Hue, chroma or value, translucency. So this is the summary of a anterior teeth selection. And these are the various components of smile, that is lip line, smile arc, upper lip curvature, lateral negative space, smile symmetry, occlusal frontal plane, then dental components and the gingival components. And coming to the conclusion, that is changing trend in field of aesthetic dentistry will reorient the art element involved in aesthetic dental creations, but its established scientific guidelines always provide the sound basis for this change. By using these principles, the right smile can be created, one that reflects personality and character of the patient with all the benefits to health, spirit and mind that comes from confidence. And these are my references. That's all for today's lecture. We will discuss the posterior teeth selection in the next lecture in detail. Thanks for watching. Stay tuned.